Assalamualaikum and hello. My name is Siti Mariam binti Muhammad Rani. My student ID is 2023851798. In this role play, I will take on the role of a nurse. My character is responsible for managing and resolving the conflict while remaining calm, firm, and empathetic.
Assalamualaikum and hi. My name is Nurul Natasha Amrina binti Muhammad Zulkifli and my student ID is 2023415338. In this roleplay, I will be playing as the customer service officer and my character is someone who can be a bit defensive and she's also very dismissive towards the patient and she also has very poor communication skills. Thank you.
Hi, Assalamualaikum. My name is Nahda Binti Mansur. My student ID is 2023277354. I play the role of a patient. As a patient, my character represents a concerned and frustrated individual who feel confused due to the unclear information. Through this scene, my emotion change from frustration to calm after ethical communication and empathy are applied.
Assalamualaikum and hi. My name is Nurul Aini binti Nur Hakim. My student ID is 2023836956. My role in this group roleplay is as Hospital Relation Officer of this healthcare institution, responsible for overseeing the overall operation, administrative efficiency, and quality of patient care to ensure that hospital services are delivered actively, ethically, and in compliance with healthcare regulation.
Hello everyone, this roleplay is about ethical communication in hospital customer service. In a healthcare environment, communication is not just about giving information, but also about showing empathy, respect, and professionalism. Patients come to hospital in vulnerable situations, and how staff communicate with them can greatly affect their trust and emotional well-being. In this scenario, we will demonstrate how poor communication such as lack of empathy, poor listening skills, and unprofessional attitudes can finally lead to conflict. We will also show how ethical communication practices, including active listening, clear explanations, and respect for patients' rights, can help to resolve misunderstandings and improve patient satisfaction. This roleplay highlights the importance of ethical behavior in healthcare service and how hospital staff should communicate responsibly when handling patient concerns.
Good morning, ma'am. Welcome to the customer service department. How can I help you?
Good morning, Miss. I would like to ask about my hospital bill. There are several charges that I don't understand and no one explained them to me properly.
Can you please wait for a while? I have to attend to another case that is more urgent.
Okay, Miss. I'm sorry, Miss. I already wait for almost 40 minutes. I feel like my concern is being ignored.
Okay, sorry. What seems to be the problem? We are very busy, ma'am. Can you please make it quick?
I was admitted to the hospital for 3 days due to the stomach infection. After I was discharged, I checked my bill and realized I was charged for an expensive treatment and medication that I was never informed about. Some of medicine were not even given to me. I don't understand why I was charged for them.
Ma'am, all the charges listed in the bill are based on what the doctor ordered. If it is stated there, it means the service was provided. We just bill according to the system. Just because you don't remember doesn't mean the medications were not given to you. It was probably prescribed to you in the ward.
That's not fair. No doctor or nurse even explained this just to me. As a patient, I have the right to clear and honest information. Your tone made me feel like I'm being blamed.
I am also just doing my job. I cannot change anything if the system already shows the charges. You can submit a complaint to the billing department if you want, but you still need to settle the bill first.
This is very unprofessional. I feel disrespect and ignored as a patient.
Excuse me, may I step in for a moment? I think it's better for us to calm down first and address this professionally. Miss Nada, I can clearly see that you are frustrated and I truly understand your concern. Being charged for services that were not explained can be confusing and stressful. Your feelings are completely valid and you have the right to ask for the clarification.
Thank you. I just want someone to listen and explain things properly.
Yes, of course, Miss Nada. At our hospital, we do value patient dignity, respect, and transparency. Clear communication is part of ethical healthcare practice. As customer service staff, we should really take the time to listen to the patient's concerns. Instead of making assumptions, we can go through the bill together and explain each charge clearly. Medical procedures can be confusing, especially if they are not properly explained.
You are right. I apologize for my earlier tone, Miss Nada. Let me go through the bill with you in detail again.
Alright, thank you. Miss Nada, we will review the bill item by item. If there are any charges that were unnecessary or not communicated to you, we will bring this issue to the management for further review, and we will appreciate for your feedback to improve our service too. Thank you. Also, Miss Natasha, before we escalate this issue to the management, I think this is a good opportunity for us to reflect on what just happened. Ethical communication is not only about following procedures, but also about how we make patients feel when they approach us for help.
Yes, I realize that now. I think I was too focused on the system and also my workload. I did not take the time to listen properly, and my tone was unprofessional. I did not mean to disrespect her, but I can see how my behavior made her feel ignored and blamed.
Exactly. Patients come to hospitals when they are vulnerable, physically and emotionally. When they ask questions, it's usually because they are worried or confused. As a healthcare staff, we have an ethical responsibility to show empathy, patience, and respect even when we have a lot of workload and even when we are busy.
You are right. I should have acknowledged her concern first and explained the charges clearly instead of just being defensive. I understand now that good communication can prevent conflict from escalating.
That awareness is important. Ethical challenges like this are learning moments. What matters is how we improve after recognizing our mistakes. Let's make sure the management is informed so the issue can be handled fairly and transparently.
Thank you for guiding me, Nurse Mariam. I will take this as a lesson and work on improving my communication skills so that patients feel more respected and also heard in the future.
Good afternoon, Mr. Nada. My name is Aini, and I am the Patient Relation Officer. Thank you for bringing this matter to our attention. First and foremost, I would like to sincerely apologize for the distress and inconvenience you have experienced during your visit to our hospital.
Thank you, Miss Ainu. I only want transparency and fair treatment.
I completely understand your feeling, and you are absolutely right to expect clear explanation. As a patient, you have the right to transparency, respect, and ethical communication from all hospital staff. What you experienced earlier does not reflect the standard we aim to uphold. After carefully reviewing your bill I can see that there are charges that were not clearly explained to you, including medication and treatment fee that may not have been necessary. We will conduct a full review with the medical team to confirm these charges.
I appreciate that. I only want to pay for what is fair and properly explained.
We will make the correction immediately, and we will also ensure that you receive a detailed explanation of every item in your bill. In addition, this situation highlights the importance of ethical communication. I will take responsibility to ensure that our customer service staff receive further training on empathy, active listening, and professional conduct so that patients feel respected and heard at all times.
I sincerely apologize once again, Miss Nada. I will try to communicate more professionally in the future, and I will not be dismissive of any patient's concern from now on.
Thank you for handling this ethical. I feel more respect and reassured now. I appreciate it. Thank you to the customer service, nurse, and Miss Aini for your attention and assistance.
Conclusion. This situation shows how important ethical communication is in healthcare setting. Clear information, empathy, and respect are essential in building trust between patient and hospital staff. Miscommunication and poor attitude can lead to frustration and dissatisfaction, even when medical care is provided correctly. As healthcare professional, we carry a moral and professional responsibility to ensure that every patient feel heard, valued, and treated fairly. Ethically, communication is require empathy, honesty, accountability, and the willingness to correct mistakes when they occur. From a management perspective, this incident serves as an important learning opportunity. It reminds us that continuous staff training, especially in areas such as customer services, ethical conduct, and patient relations, is necessary to maintain high standard of care. By fostering a culture of accountability and compassion, we can prevent similar issues from occurring in the future. Ultimately, our goal is to provide patient-centered care that prioritizes dignity, trust, and fairness. By actively listening to patient concerns and responding ethically, we can create safer, more respectful, and more positive experience for every patient to strengthen their relationship between patient and healthcare providers. This commitment not only improves patient satisfaction but also enhances the overall quality, protecting patient rights, ensuring transparency, and continuously improving our communication practices for better reputation of our healthcare institution. Thank you.